This is Dr. Raul Vazquez from G Health Enterprises, here to talk about COVID-19 in the G knowledge moment. The way this virus gets in is through these ACE type 2 receptors, and you're at risk by having them. Some of us have more or less, depending on our medical conditions. Now, the interesting thing with this virus is it attaches through there and it comes in as a result of these receptors. Now, these receptors, we have them in different locations. So we have them in the lungs, kidneys, heart, nose, and gut. And when it affects the pneumocyte type 2 cells in the alveolar, it enters and causes all these viral replications, which leads to a lot of symptoms. And in the lungs, when you get it, it causes the cough, fever, and shortness of breath. This is what we often see with people, and this is why we're so concerned. People with hypertension have RAS systems that lead to hypertension, and if you're not treated, you make a lot of these receptors in your lung. So you have more of these receptors than people without hypertension, and that's why black and brown populations are affected. The same thing with asthma. You have more of these ACE type 2 receptors, and it becomes a problem, and that's why this group is at risk. Inhaled steroids that we give them are a good treatment for that. So that's actually a good thing. With diabetes and insulin, because of the impact, it also affects these receptors, and you end up having more than people that don't have it. In the nose area, these receptors are often the problem because these patients, when it affects the nasal area, will have issues with regards to taste and smell, and they may be carriers without other symptoms. And it's real important for us to look at that as the disease. We start to test and trace and quarantine people because they don't even know they have it, and they're passing it on to other people. Now, with regards to people that have the symptoms, the cough, shortness of breath, and the fever, it's involving more of the lung. And yes, they have to be quarantined. These are the individuals that have to be treated. We have to make sure we follow these protocols when it comes to things in the house because it's real important to make sure that no one else gets infected. But the local health department is really not looking at this. They're not equipped to follow this. I think the more we learn, manage hypertension, diabetes with the medications which protect people, we're going to have better outcomes. So this is just the start of multiple videos. This is Dr. Raul Vazquez from G Health.